Eternal Father, I offer you the body and the blood, soul and divinity of your dearly beloved Son.
Good morning, Father.
Morning, Claire.
Welcome back to Moments of Healing.
Thank you.
Something I know you get a lot of is you get requests from people asking them, their spouse, their parent, their child, neighbor, they've gone into the hospital,
Yeah.
could you go visit them? And I guess in the past you had a little more leeway, but with COVID now, things have gotten a lot tighter,
Yes.
and it's harder for people to understand. So why don't you explain a little bit about the rule change and what people have to do now if they want you to go into a room?
Okay, I would say before COVID, there was a trend in hospital ministry of like the patient had to ask you to come. That was already in place. And in some cases, they did not even ask what religion you were. Last night I had dinner with a priest in DC, and he mentioned 2 hospitals where he's not even allowed in. Now, this was already true in many places already. You were allowed in, but the person had to ask you to come in. At Fairfax, we've had a Catholic chaplain ministry there for over 40 years.
Wow.
So we've been there a long time. Before COVID, we'd print out the list, maybe about 125 Catholics, had 3 or 4 Eucharistic ministers. And we would just, and again, people could request, like you could have a form, once communion every day, once confession, communion only on Sunday. Or somebody would say, I don't want to visit. So we would, there was more free leeway in visiting people, and they didn't so much have to always call, but it was always good because people could still slip through the cracks. So we'd go make these lists, go to room. COVID has kind of changed this, has accelerated a trend. And the trend is towards only visiting people who they themselves have requested to go, that they have to request. Because the visiting hours at Fairfax are between 1 o'clock and 5 o'clock. And not only that, it's one person per patient. Now, there are exceptions. Like if somebody's actively dying, there are exceptions. So it's not a universal.
But it's rare.
But it's the exception to the rule. Like I was talking to a young lady who's in bed rest, and her husband and her mother cannot visit on the same day. Now, why is this important? Because every day, like this morning, I got a call from a man who wanted me to visit his Hindu mother, and I'm not even sure she speaks English all that well. He's not even really allowed in. And so the gist of the call was, can you visit my mother, would be good if you visit. And I asked a simple question, does your mother want me to come? And he said no. He wouldn't request it. And I'm saying, and he said, if you just happen to walk into the room. Well, you could bump into somebody at McDonald's, you could bump somebody at the mall, you can bump into somebody at the movie theater. You're not really going to bump into somebody, happen to walk into a room.
Right.
And so I was explaining to the man, I'm happy to see your mother. Very happy to see your mother. But she needs to request.
Right.
That I come. I'm very happy to go. I'm happy to pray with her. Happy to even pray for her in the hospital, like in a chapel. But I was trying to explain, I'm happy to go. But I need her to want to request. Because I can't walk into a room if the person didn't actively request me. And this is just not me. This is hospital policy. Just think about how this tightening up of procedures. If they're even tightening up, 1 to 5, just family members visiting,
And just one.
Right. Often I get calls from priests, text messages that one of my members of my parish, and sometimes people will text me, my next door neighbor, I saw an ambulance, can you go visit?
Right.
And And while most of the time they are Catholic and very happy to visit, I say the same thing. Have the family member request me. Have the family member request me. Because if it's important enough for me to be there, the family member should want to request, because we don't want to superimpose our faith. So I think what I'm saying about all this is this is a trend that is not going to change. This trend, this way of doing things in hospital will be in effect for at least 2020. But I think we're setting up policies. Hospitals are setting up policies that are going to be in effect, I think, going on. Yeah. And so what this means is that the patient, the husband, the wife, the children have to take more responsibility. And they themselves have to, contact their parish, contact their parish priest, or contact the chaplaincy in the office. Because the hospitals are very concerned about not spreading COVID unnecessarily. So that's connected to this. Right. That's connected to this. So underneath it all is this idea of limiting unnecessary contact with outside visitors. Right. And so they do that to protect the hospital. So if somebody requests me, they themselves have requested me. Right. And so they understand that. So again, I say this because, I have to, and every other hospital chaplaincy has to adhere to hospital policy. I got called about visiting an anointing person at another hospital that wasn't Inova Inova. There's 5 Inova hospitals, but this one was not Inova. And I was trying to explain to the family that I don't have any more right to go into that hospital as you do. Right. Because it's not, my badge doesn't mean anything there. Right. It's just Fairfax. Or Inova. Yeah. So again, I say this because these are, and same thing with nursing homes with parishes. Sure. This is the same thing with nursing homes and parishes. In fact, today it might even be more true in nursing homes and parishes. So again, I say this because this is a new reality, and I think this is not going to change. So it's more incumbent upon people in the hospital for them to take personal responsibility. It's not enough in most cases now to say my friends, or even a priest to say one of my parishioners. Right. Because it should go to the next level. The parishioner's husband or wife should call.
Well, and just to clarify, that family member should be in the room, though, right? They can't just call and say, "Oh, from home," and say, "Oh, my dad's in there."
Well, if somebody is actively dying, yeah, sometimes they do call and they're not in the room.
Okay, but would the hospital take that as okay?
Yeah, if the family member called. Okay. And like in COVID, again, I anointed lots of people. There was only one allowed in the room. Okay. Family was not there.
But you assume then that the patient itself also wanted you there.
Yeah, they wanted to be there. They're Catholic. They wanted to be there. They requested it.
And it's as simple as just asking the nurse, right?
So that's very different.
You don't have to fill out a
That's
form.
very different than, like this Hindu man.
The woman, the son.
This Hindu man wanted me to go visit her Hindu mother, who's not requesting me. Right. That's very different than a husband requesting last rites for his wife, who was devoutly Catholic, and he knows that she would have said yes. Okay. Yeah, because sometimes if the patient isn't aware or can't speak for themselves, as long as or the family member knows that this is what they wanted, it makes a difference. Yeah. And I think in a previous session, you also had advised people that if you know you're going to the hospital, stop by and see the parish priest first before going to the hospital, because it would be a lot easier to
get in or to get the sacraments that way versus wait until you're there.
Yeah, I mean it's
Sadly.
yeah. I mean I think if you know you're going to the hospital, you know we can also make a turn and be like, you can call your parish priest
Mm-hmm.
to, you know, stop by after mass and give you anointing.
Mm-hmm.
And before you go to the hospital too. That's something we can do. We don't always have to wait to be in the hospital.
Okay.
You know.
But I guess the bottom line is that nowadays, either the patient or a family member needs to specifically ask for the Catholic chaplain, and the assumption should always be that the patient wants.
Yeah, the patient wants. The patient.
Yeah. All right. Well, thank you. Hopefully that can clear it up. It's sad we're going that way, but
yes, yeah.
That's life.
Yes, life.
For the sake of his sorrowful past.